Hi everyone, my name is Linda Bernicki and I'm a project consultant with homelessness initiatives with the Rural Development Network. I'm here today to share information about the RDN Emergency Map Program Guide. Over the past decade, through our work across Canada, the Rural Development Network has received multiple inquiries from communities requiring assistance with developing temporary emergency shelter or MAP programs, including common questions that you see on the slide. In response, RDN facilitated a Pan-Canada research project with the intent of developing a framework for communities based on best practices and through the lens of reconciliation. Through this consultation, we heard that not only is there a need for the creation of an online resource to help groups establish MAP programs in any rural or remote community, but a desire to spread the conversation across Canada and collaborate between communities in the development of a coordinated response to homelessness. We are able to do this guide in part thanks to the Government of Canada, Canada's Reaching Home Canada Homelessness Strategy. We sent out over 100 requests from across Canada to invite people to participate and provide feedback. And as you can see from the slide, we received a diverse response from Nova Scotia to British Columbia. The majority of the organizations that responded were non-for-profit organizations, with a few being municipal-led organizations. We heard from service providers across the country that the process for applying for zoning and building permits varies dramatically based on each municipality process. In addition, the amount of support, in kind or financial, seems to be interdependent on the leadership of the municipality, along with the role that they have identified that the municipality should play in responding to the growing issues of homelessness and housing insecurity. Do you know what your local municipality response is with homelessness in community? We are truly grateful and most thankful for the feedback and participation of those with lived experience in our survey and focus groups. Of course, as you know, best practices and responses are most successful when they are informed by people with lived experience. So when people with lived experience have been able to share their story with us, we're going to go through a couple of responses that we asked them. On the slide, you can see some quotes from the people with the lived experience. For example, the MAP program helped me find a place to live. When we were talking to people with lived experience, we asked them if they accessed a wet or dry program. A wet program was identified as a shelter that does allow individuals access if they are under the influence of drugs or alcohol, versus a dry shelter that require people accessing the service to abstain from drugs or alcohol before accessing the service. So as you can see, 83.3% of people were accessing the wet programs. When we asked those with lived experience what the main service or need that they accessed, the top responses was shower services and food. The next few services that people were requiring was laundry and cultural services. And we found it really interesting as we went through this process with the folks that there was a variety of different responses, but shower services always seem to come before food. So what is this guide? Well, the intent of this guide is to provide communities with a clear and concise steps based on research, best practices, reconciliation, and lessons learned to go from the conception to implementation of a MAP programs. Steps will include, but are not limited to, addressing issues and concerns that commonly arise from the creation of a MAP program, community engagement process that aligns with the diversity across the country, addressing the limited capacity a lot of smaller communities have, how to facilitate complex and difficult community conversations, and most importantly, how to gain community and municipality support. RDN recognizes and acknowledges that the temporary emergency shelter and MAP programs are not long-term solutions to the homelessness and housing crisis affecting communities across the country. But due to the lack of resources, that are available to most rural and remote and Indigenous communities. These programs are often all that there is, and therefore MAP programs are saving lives. We also want to make a note that while this guide can be used by any community, the primary intended audience is for rural and remote communities in Canada, as well as First Nation, Métis, and Inuit communities. This guide primarily uses the Canadian definitions of homelessness as established by the Canadian Observatory on Homelessness, as well as separate definitions that account for the unique experiences of youth and Indigenous peoples, including but not limited to BC housing. Taken together, these definitions form a comprehensive definition of how people in Canada are affected by homelessness or housing instability in a variety of social and cultural contexts. So what is a MAP program or a temporary emergency shelter? How is it different from a non-temporary emergency shelter? Temporary emergency shelters exist primarily to protect people from the elements, usually during the winter. However, in Alberta this past summer, we also found that emergency shelters were being used to keep people out of the elements when it was extremely hot. One of the key differences between a MAP program and a regular shelter is that it's temporary in nature. It's also interesting to have the conversations across the country for the vast different areas of what services they provide and what services they don't provide. So depending on the ability of the organization that is leading the initiative, the funding that's available, and the response required, that varies from community to community across the country. If your organization is thinking about developing a temporary winter emergency MAP program, evaluating your organizational capacity, readiness, and identifying the community need are vital steps to ensure a strong foundation for a strategic framework. Does your staff have the training and capacity to be able to respond to the increased needs that is going to be tasked upon them? If they don't, does your organization have the capacity to hire other staff or provide the training for the staff? Does your organization have the liability that it's required to operate such an initiative? Something to think about. Is your desired outcome informing your organizational capacity to take on such an initiative? Or are you evaluating your organizational's capacity to determine what your desired outcome can be and what type of initiative you can operate in your community? Identifying your organizational values will guide the conversations and development of the service delivery guiding principles that will determine the type of MAP program or shelter your organization will implement. The Province of Alberta Service Delivery Guiding Principles is based on a value that emergency homeless shelters have a mandate and responsibility to assist and encourage residents towards increasing levels of self-resilience and self-determination. Aligning the needs, the response required, and the service delivery principles can be challenging and is often informed based on the variety of knowledge and experience in developing such projects. The Saskatoon Housing Initiative Partnership Service Delivery Guiding Principles is based on shelters will do their best to ensure everyone is allowed access to emergency shelters, including intoxicated persons or those previously placed on a service review list. If an individual is not admitted, shelters are responsible for making a referral. Is that a value your organization believes in? Have you considered what your guiding principles and strategies will be, could be, should be? What values will lead you to these decisions? Does your organization and your response value a harm reduction philosophy? Does it value a trauma-informed care lens? Do you value discharge planning process with your case management? As I'm sure you're aware, Indigenous peoples disproportionately experience homelessness across Canada in comparison to non-Indigenous peoples. Housing instability and homelessness must be understood through that of the Indigenous lens, and there must be a greater understanding of the unique challenges Indigenous communities face that often stem from the Indian Act, history, colonization, and intergenerational trauma. It is vital to be mindful of not only what type of service your program is providing to Indigenous people, but who is leading your project in the response to these services. Are you taking a look at your response through the lens of reconciliation? Are you reviewing the 94 calls to action? What impact does the United Nations Declaration on the Rights of Indigenous People have on your value decision-making and the type of services you would like to provide? According to the COH, racialized populations are especially vulnerable towards homelessness. Did you know that 1 in 5 racialized groups experience symptoms of poverty as much of a greater rate than non-racialized Canadians? Racialized groups are often subject to more violence and discrimination in comparison to other equity-seeking groups. This is so important to consider when trying to create an equitable and safe environment for your program. Have you considered how you would deal with language barriers? Would someone's immigration status be a barrier to access services? Do you have the knowledge and experience to respond in a way that identifies different religion and spirituality responses? As you reflect on some of those questions, we're going to move forward and talk a little bit about community engagement and what the guide touches on with respect to community engagement. This is one of the most important parts. Consultation is not only important, but it can make a difference between success and failure of your program. It is vital that the community engagement approach identifies who your target market and key audience is and aligns the engagement around that specific group. For example, your community engagement approach would not be the same with elected officials as it would be with those of lived experience. There should be multiple consultations at various stages of the project to ensure that relevant information is gathered and shared at key points in time. The number and type of consultations or engagement events will depend not only on the type of scale of the project, but the community readiness to support such a project. The guide, with permission, uses the community toolbox to explore in detail the stages of community readiness and the recommended steps to ensure you're ready to move forward. The guide continues to use the community toolbox resources to explore the 6 dimensions of community awareness. When we take a look at the 6 dimensions of community awareness, you need to ask yourself, or your organization needs to ask themselves and reflect, to what extent are there existing efforts, programs, and policies that address these issues? To what extent do community members know about existing local efforts and their effectiveness? To what extent are appointed leaders and influential community members supportive of the issue? What is the prevailing attitude of the community towards the issue? To what extent do community members know about the cause of the problem? To what extent are local resources available to support your efforts? The Hardwood Institute of Public Innovation challenges you to ask the following questions as you think about starting an emergency MAP program through the community engagement process. Does your organization face inward or outward? How are you sharing public knowledge to reframe what matters to people and enlist allies? What impact do you want to create? Remember, authentic community engagement does not happen without vulnerability. And vulnerability takes trust. The guide provides examples of the community consultation process along with recommended discussion points. A question to reflect upon: how will your organization gain trust in the community? The guide continues to go into detail, which we just can't go into at a deep level at the conference, but we wanted to highlight other areas that the guide talks about. It talks about zoning and building regulations, permits, insurance, policies and procedures, lots on policies and procedures, and of course health and safety, staff training, volunteer training, program evaluation, data collection, and sustainability, and the funding opportunities around long-term funding and sustainability. I wanted to end my presentation with this quote: "Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it is the only thing that ever has." Thank you so much for joining me today, and I'm happy to take any questions.